Osteoporosis, what you should know. The term osteoporosis is synonymous with women, low calcium, weak bones, and fractures. But there's more to the osteoporosis story than just calcium deficiency. Osteoporosis is the weakening of bones which makes them susceptible to fracture. In 2008, an estimated 25 million Indians were affected by osteoporosis, mainly because of vitamin D deficiency. This is usually due to low exposure to sunlight and low dietary vitamin D. By the bone mass density, or BMD. The BMD varies between the sexes and between race. Men usually have a higher BMD when compared to women, and usually African Americans have a higher BMD as compared to Caucasians or Asians. Usually the BMD naturally decreases with age at the rate of 0.3 to 0.5% every year. This degeneration starts around the age of 30 to 35 years. In women, estrogen is important for BMD maintenance. Post-menopause, there is a marked decrease and in levels of estrogen leading to accelerated BMD loss. Here are some factors that put you at risk of developing osteoporosis. Women and people of Asian descent are at a higher risk. People who are above the age of 50 with a family history of osteoporosis. Physical inactivity, calcium deficiency. Smoking leads to 5 to 10% extra BMD loss. Drinking excessive alcohol, low weight, rheumatoid arthritis, medications such as heparin, prednisolone. Osteoporosis is often asymptomatic until a bone fractures. Then an X-ray and bone density measurement confirms the diagnosis. The normal bone is made up of protein, collagen, and calcium. When the bones begin to lose their density and become more porous than normal, they are more easily compressed, making them more likely to crack, like in the case of a hip fracture, or collapse, as in a spinal fracture. Other common areas at high risk for fractures are ribs and wrists. Spine fractures result in long-lasting lower back pain, loss of height, and a curved spine, also called vertebrae collapse. Hip fractures generally occur after a fall, may require surgery, and are slow to heal. Bone fractures lead to continuous pain, low quality of life, loss of ability to do routine tasks, and hence decreased productivity. Often, hip fracture patients need long-term care. Usually, loss of BMD is first measured when there is a loss of bone density leading to a condition called osteopenia. This condition, if left unchecked, leads to osteoporosis. A brief review of bone metabolism will help understand factors affecting BMD. During childhood, the skeleton uses and stores calcium such that bone density continually increases until age 25 and remains constant until 30 to 35 years. The level of calcium in the bone depends on a balanced availability of calcium, phosphorus, magnesium, and vitamin D. Vitamin D is critical for proper absorption of dietary calcium from the intestine, while phosphorus and magnesium regulate the amount of calcium absorbed by the bones. While these minerals help in calcium absorption, beware! Excessive protein and fluorine can hinder calcium absorption. Keeping osteoporosis at bay could be easy as a few lifestyle changes. Quit smoking. Smoking causes a decrease in your BMD and only hastens osteoporosis. Minimize your alcohol intake. Regular exercise. In order to help your body fight osteoporosis, regular weight-bearing exercises help to strengthen the muscles and bones. Maintaining healthy weight. Overweight and obese people are known to suffer from osteoporosis earlier in life. Maintain a low salt and high calcium and vitamin D rich diet. Here are some bone-friendly foods. Some good sources of calcium are milk products, tofu, green leafy vegetables, and fish. Ideally, you should include 1,200 to 1,500 milligrams of calcium in your daily diet. 800 to 1,000 international units of vitamin D from fortified cereals and milk products, fish and sunlight should keep osteoporosis at bay. About 1,250 milligrams in children and 700 milligrams in adults of phosphorus found in milk products, whole grains, Peas, beans, lentils, nuts, and meat should be included in your diet. 300 to 750 mg of magnesium from common sources such as green leafy vegetables, whole grains, seeds, nuts, fermented soy products, meat, and fish will help you keep BMD in check. Here are some of the basics on osteoporosis. So go ahead, eat right, and stay healthy. For more on your health, log on to health.india.com.